And then, and before you both came on, I was just talking to everybody, and I gave them a quick glimpse into some of the numbers that India and world over we are looking at on Cancer Day. And so far, in my own experience, we've seen conversation largely in India revolve around the stories of struggle. We've seen them revolve around stories of heroism as well, on people who fought cancer and how circumstances as well. I remember as a cub reporter, one of my first stories some 12 years ago, I think, was of a little boy who was a cancer patient. He was just about 12 years of age, and he was staying in a public loo outside AIIMS. And during the day, and he came from a very poor family from Bihar. Their parents sold off their land, sold off the little shop that they had, a kirana store that they had in Bihar, to get actually money, just to get him here for treatment at AIIMS. And imagine the plight of a family like that, where you go in inside AIIMS for your chemotherapy, and you come out and you stay inside a public loo. So that's that reality. And then there is a reality of people, the other India, where with the best of resources, sometimes lives are lost. With the best of technology and information at their behest, lives are lost. So I think today the conversation is very critical, because we are trying to understand that, is there a way to actually nip it in the bud? Is there a way to understand how can we do early detection so that more and more lives can be saved? Right? And quick introduction for all our viewers who have joined in as well. So Subhendru is the CEO and co-founder for Early Sign. Early Sign, as the name suggests itself, is something, and he works towards, it's a biotech startup and offers early stage diagnostic solutions, etc., for medical devices for the early detection of multiple kinds of cancers. And there are lots of tests that they're working on to try and, like I said, catch it early, treat it early, save more lives. That's the motto there. I'm very keen to have learn more about how this is happening and what's the R&D behind it from you, Subhendru. Also with us today is Dr. Girish Gupta. He is, apart from being very new on Instagram, like he said, also he is heading research and development for the herbal products and Nutra. It's a Xeon Life Sciences. And he sort of is the other side of the conversation here, where if you are undergoing chemotherapy, if you're undergoing a cancer treatment, etc., you end up becoming immunocompromised. You have issues with nutrition. So he's taking care of cancer treatment when you're undergoing that. What are some of the supplements that people can really talk about? And this is very, very key. Supplements whose importance we've begun to understand more and more, especially during the pandemic year. So we'll talk about that also in a bit. But let me begin with Subhendru here. Subhendru, take us through what part of the journey are we in at the moment, especially in India. This has been last year has been a phenomenal year, at least. Lots of Indian names came up where blood tests now can tell you whether you have cancer or no. There is huge sort of innovation, R&D happening on that front. Where are we on that journey, and what is it that you are also doing?
Yes, first of all, thanks for this introduction. And yep, as you have seen and heard that a lot of cancer advancements are happening nowadays. If you have heard about different companies in US and UK who are running multiple large-scale clinical trials with blood-based, microRNA-based diagnostic device. One is Illumina Grail, which has recently been acquired by Illumina, and it's actually been funded by Jeff Bezos also. So companies like this, they're actually advancing this entire thing, because what we have learned so far is cancer or any other disease is not a problem. The problem is if you don't detect it early, it becomes a problem. Once you detect this disease early, you can actually treat it easily. Maybe with lifestyle changes, dietary changes, or maybe some supplementation stuff, you can easily cure it. Plus, doctors have a better chance of saving that patient, giving that patient a normal life that it deserves. But once you are late, once the cancer is already metastasized, or let's say it has spread to other parts, then comes the worst thing, that even after the treatment, the cancer relapses after 9 or 10 months. Or maybe the doctor tells the patients or their relatives that maybe after this treatment, the patient won't survive. So the patients and the family, they are selling their homes, they are doing so many things. They're spending 10 to 12 lakhs on the surgeries. Yet, knowing the fact that the patient won't survive, they won't even see 1 year or 2 years. Plus, even if they survive for 5 years, they won't have a normal life. So why they are spending like 15 lakhs, 10 lakhs, 12 lakhs? They're selling their houses, they're selling their jewelries and everything. They don't have a normal life for their kids, the lifestyle. Because that is the problem. Plus, most of the cancers.
I think, Shubhendra, what's also happening at the moment is that there is, at the moment in the country, a lot of chatter about cancer.
Yep.
And we've spoken about this at length, and through the past decade at least. I remember in one of the seminars I was in earlier, they talked about how the cancer conversation had to be made more public. And in some ways, big celebrities who got diagnosed with cancer and the conversation they brought forward, foundations they run, that sort of brought in a lot of conversation as well. That sort of got the country to wake up to say that, oh, this is right at our doorstep, and we got to take note of that. But, however, this conversation still is around fear.
Exactly. Yes.
The conversation is still about the worry, and the minute you hear the C word, that's when people get really worried. I'm not sure if people still are talking enough about early detection measures and how much people know about this. If you have a family history, what is it that you should be doing? If there is something that you've noticed, what are the early telltale signs, etc., that you should that should alarm you, and mostly should alarm your physician and your doctor as well, and you should be taking that into account. So I want to hear more from you on what are those early signs, what can be done, what is the tech available out there now to sort of do this. So, think about that while I go to Dr. Girish with the next question. Dr. Girish, you do something very important, but when it comes to immunity, and here, Xion Life Sciences is set to launch its first anti-cancer and pro-immunity product as well. But can I just say, pro-immunity products now are such a debatable topic, especially after COVID, for all good and bad reasons. There is lack of trust. There are questions that are being asked. There is the huge space of science versus Ayurveda. How do we bring it together? Does it really help? Is it really doing anything? So for starters, and for some of the non-believers out there, what would you say? What is the R&D behind what you're doing right now? What evidence
Thanks,
do you have?
Sonali. First of all, I am feel great to on show and on World Cancer Day, and we are very happy you provide us the opportunity as is Xion Life Sciences. So definitely, like, immunity is a buzzword like for the last 2.5 years, and we are seeing in the period of pandemic there are lots of product has been launched by many companies in India. Either it's a nutraceutical company or Ayurvedic based companies. So there is a huge demand of immunity boosters with the cope-up of COVID-19. And of course, there would be a interlinked for the cancers also, because cancer is it's a cause of morbidity and mortality nowadays. Of course, so there would be a need of early detection is very mandatory, and need of an hour. And being as a Xion Life Sciences, we are working on to day-to-day basis for innovative product, for their development, and for those purpose we have collaborated with various research organizations. And as you mentioned about pro-immunity and cancer, so of course there would be a link, and there are different inflammatory markers which has been involved into cancer cell growth. For that, if we are providing a proper supplementation and proper diet, which could go and work on to the different cycle of managing the growth of cancers. So that.
Can you give some examples, Dr. Girish? Tell us what exactly is it and how does it impact your body?
Multiple aspects like cell growth, cell proliferation, and apart from that, if we are going to take anti-cancer pills also as a treatment from the allopathic side, so there would be a lot of side effect of all those medications in long-term usage. And as you know, like for which we go for a anti-cancer therapy as a radiation or chemotherapy, and subsequently we'll go for a operation also, surgery. So ultimately, like what happened, your lifestyle, and you will be going to be dissatisfied with your life. And lots of multiple attributes which could be happening, wherein the nutraceutical will play a major role to provide you the nutrition. So
No, I understand that. I understand that. When you say nutrition, and like I said, I've seen that with personal experiences with very close family members as well, that
Right.
nutrition plays a huge role, and how entire life, what you eat, air you breathe, where you go, what you drink plays such a huge role when you're doing it. So I want to understand some concrete examples from you and try and know which part and how does the tech really work here, and what exactly is it that these medicines really do. Like I said, people are losing their faith in pro-immunity medicine, so-called immunity medicines. So we need to understand more and more on what exactly is the science behind it as well.
So
If you could talk
basically,
to us a
immunity is
little bit
linked
about
with
that,
multiple attributes. Actually, it's not only with cancer or with respect to COVID. Like for your overall lifestyle, for different climatic condition into India and worldwide also. So you are getting to impacted with the climates, and there would be your immunity should be like play a proper role. And for maintaining your immunity, you should have a proper nutraceutical diets, nutraceutical supplementation. Let's say if I'm talking about omega-3 fatty acid, I'm talking about vitamin A, vitamin D, vitamin B, multivitamins and multiminerals also. So all these multiminerals composition will play a major role into enhancement of immunity. But of course, as a second side of the coin, second part of a flip of coin, if you are going to consume a lot of immunity booster, that would be also harmful also. So you need to take a very defined and specified dose which could suffice the requirement as per your body. And there should be a proper guideline which has been given by National Institute of Nutrition as well as ICMR. So we need to work in a very strict guidelines and regulatory compliance that would be helpful to control all those elements that could be happen because of either COVID or cancer.
Okay. So what you're essentially saying is there's no blanket sort of medicine that can be taken by everyone, and it has to be taken in consult with your doctor, and everybody and every individual is going to be different in how they respond to these probiotic and pro-immunity things is also going to be different. So Bhendra, if I can come back to you and understand what exactly are, I mean, for people who are just looking at this live right now, and I'm getting lots of questions about understanding some basics here. What is it that is available in terms of early detection in the country at the moment? And where are we?
So currently, if I would say that there are no concrete devices or products which can detect the cancer even before the cancer happens. So when I'm talking about even before the cancer happens, that means that if there is no visible signs of tumor or lesion, no doctor, no physician, and no technology can detect it. So they have to wait until there's a form of a tumor or lesion which is appearing. It either could be in the breast, it could be in the colorectal cancer, or for lung cancer, or for oral cancer. Let's coming to the most common cancer in India right now, which is the topmost cancer among males, that is oral cancer. It is also second most common cancer among female. So because of the use of excessive use of tobacco, alcohol, and other things, plus our lifestyles, sedentary lifestyles mostly. So if you're talking about oral cancer, no physician can detect if there's no tumor or lesion present. Plus there are other tests available with dentists, which is like a toluidine blue test, in which the dentist will just stain your mouth with a blue stain. They'll wait for half an hour, and if there is some form of ulcer, and when they wash off the stain, it will just get stained in a blue color. But that too requires an ulcer to be present over there. And let's say if there's nothing, if there's a cancer in your throat, larynx and pharynx, they can't do this test. Then they have to wait until you feel some kind of a problem while chewing or swallowing something. But here comes the problem. What if you're waiting long enough until the cancer has metastasized? Plus, there are other solutions present which are mostly artificial intelligence or machine learning based. But here comes the problem. They also rely upon the same thing, tumors or lesion. So until you don't have these things, how we can detect it? And that is why even after so many medical advancements, so many medical devices present in the market, this problem stays the same. people, more than 77% of patients are getting to a doctor or a physician's only at an advanced stage when they have to go for a surgery. So that is why when we were working on this, we thought, the problem lies the same. Even if we make something fancier, which would be fancier to investors. Let's say I'm adding AI in this. But it won't solve the problem. It will get me investment, it will make me rich, but it won't solve the problem at ground level. So that's why when we started working, we thought, okay, the most prominent part in here is biochemical changes. So as soon as this cancer progression starts, the extracellular matrix, that starts to degrade, that starts to break down. That is the first thing happening. And that is where we come in. See, the biomarkers are released in both blood and saliva. So we can detect it in saliva in an easy way. We don't want people to get pricked every time or get their tissue samples removed. Let's do it from saliva. They just have to spit in some tube and it will be tested and will tell you that, okay, you are at risk of cancer, you're at low risk, you're at moderate risk, or you're at high risk. If a person is at high risk, then he should go for a further diagnostic procedure. That could be either biopsy, liquid biopsy, PET CT scan, or some other procedure. If the person is at low risk, then I don't think that they should go for a biopsy because it's kind of an invasive procedure. You have to go for a minute surgery. It takes.
How fascinating! It's like a swab test, which all of us during COVID are so used to now. You're saying you can actually do a saliva test and get to know if you have early signs of cancer.
Yeah.
That's what you're saying.
And the best part in here is it's really meant for the masses. Is the key to save them from cancer. Once we separate the high risk individuals from the population, that is the time when the healthcare facilities play an important role. Once, let's say, if you're testing 100 patients a day, and out of 100 you found out that okay, the 70s are at high risk. Let's go for a further diagnostic procedure. Why? We just received a pre-market approval, post-market approvals, and now we are doing India's largest clinical trials in collaboration with one of the most leading oncology chain in India and abroad. So, and we're also working on other things. So that would be for breast cancer, lung cancer, colorectal, pancreatic, all through saliva. Because we kept in mind, because I have a personal phobia of pricks and needles. So I was like, कि नहीं, अगर मेरा खून नहीं निकलेगा, तो मैं किसी का निकलने नहीं दूंगा. I was like, सारे टेस्ट सलाइवा से होंगे. अगर हो सकता है तो होंगे. And that is the thing. Even researchers believe that saliva holds more potential than serum. Because serum में जो ट्यूमर सेल्स होते हैं वो बहुत लेट स्टेज में रिलीज होते हैं. हमें तो सलाइवा में उसके पहले ही मिल रहे हैं. तो let's do that. It's easier for people. Even we can deploy these tests in rural areas when they have no medical facility.
Yeah, this has huge potential. But two questions for you then, Shubhendra. Success rate of these rates? What have your trials shown you so far?
So currently we have already done around the testing around 200 sample patients. And the results are 92% accurate. So it is like 99% specific and 100% sensitive. So you know.
Sorry, how much did you say is your sample size?
So that we did it in Nagpur only. We are actually based in Nagpur, and this is one more fascinating thing in here. Nagpur is believed to be the oral cancer capital of India. You know, around 10 lakh patients die annually in Nagpur just because of oral cancer. Because we have the highest consumption rate of tobacco. In Nagpur, it's Kharra. And that is why...
Right. But moving forward, you'll have to expand
territory.
your
Exactly. So that's why we are doing the largest clinical trial in India for oral cancer in collaboration with Southeast Asia's giant who are into oncology chain.
Right. And the cost? How much do you think?
Yeah, we have actually decided the cost. We are going to sell it for $399 so that we can make it affordable for everyone. And you can do it in a periodic way. Let's say that if you're going for a HB1AC or lipid profile or something else, you can just get that same test done. All you have to do is spit in a tube and that's it.
Right. Is this peer reviewed?
Yes.
Oh, Okay.
Plus, that is why the reason
Okay, so
I would also like to bring it
work.
that that is the reason why we are being trusted by the doctors and oncologists from American Oncology, Healthcare Global, Mises Healthcare Systems, and US-based oncologists and Cancer Centers of America. So that is the reason why the most globally renowned oncologists and biotech experts trust us. Because we have done the research so far and
Right.
made this product.
Right. No, good work and good luck, Shubhendra. I hope this gets out. And like I said, it needs much more bigger
Exactly,
sampling
yes.
size, at least, especially in a country like India where there are enough and more people and you need to start doing it. So good luck. It seems to be on to a good, promising start. Let me come back to Dr. Girish. We have last few minutes on this chat. Dr. Girish, then, like I said, it is one of the biggest issues that undergoing. So one problem is what he's trying to solve. One problem is about early detection that Shubhendra is trying to solve. The other problem is if you do get diagnosed and you are undergoing treatment, the biggest dilemma in any family is to chemo or not to chemo, right? And the only reason that problem comes up is because of the side effects. It's because of the nutrition levels then and what exactly is left behind after even a successful chemo. That's when you come in. That's when you sort of give them the proper diet to get back on their feet quickly. Take us through what is that about and where is the research over here and what does it tell us about getting the fitness levels, immunity levels back for people who have undergone.
So I just would like to one more point, Sonali, on Subhendu's topic, because we have a different opinion also in this. If I'm talking about most of the people are educated nowadays, okay, and if they are feeling something into, there would be alarming situation into their body. And they could understand something is going on differently into the body and they can start taking some nutraceutical or supplementation to prevent, at least to the onset of action till go for a chemotherapy or something that. And one more important thing is like that is fear. If anybody has been detected with the cancer, so it could be in fear like whether to go for a treatment, how to go, it will take a long time. And this could be a probable reason. The death would be more. There would be a psychological impact onto the patient if they are detected with a cancer. But we have seen personally and we experience like most of the people, those who have been diagnosed with either oral cancer or through breast cancer also, so which could be curable with a proper treatment. Okay, but nowadays, like what happened in India is evolving as a nutraceutical acknowledgement by many people and medical fraternity also. Of course, there would be a proper saturation and acknowledgement into global countries like US and Europe, and they are taking since 25-30 years into nutraceutical and dietary supplement into their normal diet. Okay, but being Indian, we are like more believing onto our diets and our food habits. But of course, over the period of time, the lifestyle has been changed and everybody has been changed their lifestyle and food habit. So that could be a probable reason of cancer.
Yeah.
Okay. So as a nutraceutical company, like we are also working on to various product like protein powder, which could be supplemented for your enhancement of your quality of life, proper supplementation, the reverse of nutrition lack into the body. So everything we are working on to that. Apart from that, we are also working on to certain herbal-based formulation, which could be proven years back in our Ayurveda, and that has been recommended for cancer and cancer treatment. So even Government of India is also supporting with different synergistic combination as a phytopharmaceutical. So phytopharmaceutical is a new category which has been introduced by our Drug Control Authority into our Drug and Cosmetic Act. And this is the new area wherein we are playing a major role and we are working in a development of product with preclinical and clinical data. So herein we are come up as a Zion. We are working very strongly and collaborated with various reputed organizations of India.
Right. So, Dr. Girish and Shubhendra, thanks so much for giving us your time and talking about this. I think there is huge potential on both ends, like I said. And on World Cancer Day, just want to close it by saying that so far the conversation has been so much about the fight, about curing it, on early detection and living and, sort of knowing that you can cure it, lives can be saved only if you are bracing yourself with the right information. That stands key. And good luck to both of you for doing more on this. That's all the time we have. Thank you so much. And thank you for everybody who joined us. There are tons of messages. I haven't been able to take any questions, but maybe soon later as well. Thanks so much. Bye-bye.